Good afternoon, Dr. Tsiang. How are you?
Very good. Thank you very much.
Yeah, thank you for the round of applause over there. Now, you were talking and touch base about looking after myopia in childhood, right, for your first session.
That's correct.
Okay,
yes.
Are we ready to roll?
Yes,
we
are.
Let's go.
Good afternoon, everyone, and thank you for being here to listen to a couple of very important topics.
That's right.
Affecting all of us.
Yes.
So let's talk a little bit about myopia, short-sightedness, 近视赶集. It is a global epidemic affecting children of today and throughout adulthood into old age.
Yes.
I'll tell you why. So as you can see, children these days are very much dependent on their glasses because they are all developing short-sightedness very early on. And let's look at the next graph that's very interesting. So as you can see, throughout the 1940s into the 2010s, the graph showing the incidence of myopia growing almost exponentially. And mainly, as you can see,
pointing up.
Yes. Mainly Taiwan, Singapore, Hong Kong, South Korea is telling us that it's affecting the Southeast Asians much more than the Western world. Now, you cannot blame on your iPads and your iPhones.
Oh, really? I was going to ask, is it because of the digitalized era that we are in?
That's correct. Look, the first iPhone started just before 2010.
Yes.
Right? The first iPad before 2010. But as you can see, from 1970 all the way to 2000, the incidence of myopia was already growing. So it is not because of your screen time.
Right. But would you say it will contribute also?
Yes,
definitely.
The reason being is that the lack of outdoor.
Lack of outdoor.
That's
coming to mall is outdoor or not?
No.
No, guys, ladies and gentlemen, children, coming to mall is not outdoor.
No.
When you say outdoor, is it park?
Yes.
You go to playground.
Yes.
Right, okay.
Something to do with UV light exposure.
Something to do with UV lights. All right.
And increased near work because every kid these days, they have to get their A stars.
On education. You must do well, must succeed, must read more books.
That's right.
Okay.
So you can cut out your screen time, but if you read too much, you can still,
Okay, so near work includes reading as well.
That's correct.
Yeah, okay.
Yes, you're right. Genetic, very small role, so we can't really blame it on genes.
Genetic means hereditary, do you mean?
It can be hereditary.
Okay, so if my parents is myopia or myopic, then I have a tendency.
Very high tendency.
Yes. Okay, so as a parent, if you have a young child or toddler, if you are both myopic, Dr. Tsiang is saying it might, a high chance that your child may be myopic.
So we'll come to that later.
Okay. Eskimos,
Yes, ask Eskimos, right?
Why is that?
So 50 years ago, none of them wear spectacles.
Oh,
right.
That's a new info.
But now, about a quarter of them need glasses. Because they are getting educated. So it's all to do with near work, lack of outdoor
activities.
Yes.
Right.
So you can't blame your iPad and your iPhone.
Cannot. But it's inevitable. We need education, right?
So that's why we'll come to that later.
Okay.
So how does it impact us? Now, it's very expensive. As you can see, focus points, you have to run these roadshows to educate people, to raise
awareness.
That's right. Okay. So it can affect your eyes physically, complicate your eyes in your older age. And psychologically as well. So myopia management is very important.
Okay.
Because people with high myopia, so people with very high power, more than 500, you're more at risk of early cataract. So 1 in 5.
When you say high myopia, means more than 500
and above.
Power and above. Okay.
So 1 in 5 will develop cataracts prematurely. Right? And then 50% risk of glaucoma.
Okay. 50% risk, wow, that's high.
6 times more likely to get retinal detachment. 9 times more to get maculopathy. So these are complications that Dr. Ellen will go into later.
Okay.
But I'm here to talk to you how to help to control the younger generation so that they don't develop these complications.
Okay.
Now, nobody talks about this, but highly myopic patients they tend to have anxiety disorders.
Oh, really?
So this is found in studies that 1 in 4 of them are more linked to depression, anxiety disorders. So they tend to be more kanchiong people.
Okay, yes.
So this is also an illness, a disorder itself. Okay.
These are affecting the psychological part.
Yes.
Okay.
So we're talking about the risk now. Now, the earlier you develop short-sightedness, so let's just say a child who develops it before the age of 7, they tend to progress faster. So they tend to become the high myopia.
Oh,
okay.
If they got it before 7 years old.
Yes, the earlier they are, the higher risk.
Based on your experience and also your work, do you think more and more children?
These are based on scientific studies.
Okay.
Okay, so it's not just my experience. Of course, my experience, I've observed it, but these are scientific papers, right?
It's a data, it's a fact.
Yes, it's a fact. It's a fact. Okay, so if we don't do anything for them, as you can see the graph, the red line, it goes up and up and up. Yeah, but if we help these children to control their myopia, there is a high success rate of reducing the progression.
Right.
Okay, you can't reverse it.
Yes.
But you want to reduce the progression.
Okay, we try to reduce the progression.
And the younger you control them, the better it is.
Okay. So early detection and intervention is very, very crucial.
That's right.
Okay.
That's right. And we also know that when you try to control the power, every 100 counts. So you can reduce the risk by almost 40% to 60%.
Oh, that's higher. Every 100.
Yes.
100 means the power, right?
The power.
Okay.
Yeah. This condition, myopic maculopathy, is a very serious condition, which again Dr. Allen will talk about later.
Which Dr. Allen will cover later.
Okay, so when we see high myopes, the ones with more than 500, when there's no control, you can see the high risk
of eye disease.
After the age of 30 years old is actually quite high.
Yeah, it's very high.
But when you try to control them, you can reduce their risk. So that's why we stress on myopia control in this day and age.
Yes.
Right? Because we can. In the past we can't, but now we can.
Now we can, yes. Okay. So how do we do that, ladies and gentlemen? Myopia
how do we do that?
Yes.
Okay. Lifestyle. We talked about that. So we reduce near work. We tell children to take breaks in between their near work.
So children, it's very important for you to take breaks.
Yes.
How long would you suggest?
They call it the 20-20. So every 20 minutes.
20 minutes.
Take a 20-minute break.
Oh, okay.
Yeah, so when you take a break, you go outdoor, you relax, you know. So your old granny telling you to rest your eyes is actually somewhat true.
It's somewhat true. Listen to your grandmothers.
Yes, listen to the grandmothers.
Yes.
Right? A lot of outdoor activities.
Okay.
And now this is when, our friendly focus point will help with all the myopia control lenses. Okay, there are evidence to tell you that all the defocusing lenses, the myopia control lenses out there, they are showing effectiveness in controlling. Okay, and then you've got your orthokeratology. So these are optical myopia control methods.
Yes.
And then the next one, which is very effective, is eye drops.
Eye drops?
Yeah. So these eye drops have been around for many years, decades.
Okay.
But we are using
for children, it's safer.
Very.
Oh, okay.
Because the data has been available for 50, 60 years.
Oh.
So in the past,
it's proven.
It's proven. So all of these are based scientifically.
Yep.
Right. So these are a few of many studies showing that the eye drops work. They're called the ATOM, the LAMP studies. You Google them, you will see them. Okay. They are done properly.
Okay.
To show you that there are very minimal side effects. They're very safe to use. And there is a finite period of using it. The doctors will tell you how to use it.
But we can't buy these over the counter, right?
No, you need a eye doctor.
You need an eye
prescription because you need regular checkups. And control.
I see. Need to be prescribed. You cannot just go to any pharmacy and get this.
More studies to show that children who are high risk, that means that you know that both parents are very short-sighted, you don't want your children to develop it. You can also start the eye drops early.
Oh, really?
To prevent it.
Okay.
Yes.
How young can they start?
You need to go to your ophthalmologist to ask them.
Okay.
So, yes.
They will be able to guide you through.
Yeah.
Okay. Would you say if they opt for like eye drop option, is it like a lifetime?
No, it's a finite period.
Oh, okay.
So nothing is lifetime, nothing is for
So the eye specialist will be able to advise you.
Yeah, that's the whole point of it. You're not
Okay.
using it forever.
Okay, all right.
So these are the defocusing lenses available in all your optometry shops and your optical shops where they can help to control the myopia progression. Okay, so you can either go for defocusing lenses or orthokeratology. Your optometrist will be able to advise you on that. Yes. Okay, so these are the few brands available that they work all slightly differently, but with the same aim.
The lens brand, right?
Yeah. Combination treatment. So children who opt for the eye drops, if the parents feel that they want to help extra, they could always combine it with their lenses, with the orthokeratology.
I see.
Because both used together, they are synergistic.
Also can?
Yes.
Okay.
Yes. Okay.
Combination treatment is also available.
So back to why it's important.
Why is it important?
Yeah. Because we want to reduce all these risks. We want to prevent it for your children to develop all these potential complications.
Yes.
We're not talking about small risks. We're talking about risks that are about 20 to 50%.
Oh, that's very high.
So our world is becoming myopic, right?
Yes.
Because, we're predicted 90% by 2050.
90?
Yes, they are predicting. This is WHO prediction.
By, sorry, which year?
2050.
2050. 90% of the world population.
Yes, yeah.
Oh, gosh.
So that's why we want to aim early
raise
prevention, raise awareness, which is what you're doing right now.
Yep.
Okay.
All right.
On to the next topic.
There we go with the first topic on myopia and how do we control and manage. So if you are hearing this, parents, shoppers, if you have children, I hope you benefited from what Dr. Tsiang has shared with us just now on how to control. So feel free to speak to any of our focus point optometrists. We are running a lot of screening tests as well for your child because we do have a children corner right at this roadshow. Now on to a second topic. This is a very, very interesting because you've been talking about cataract, is it?
That's correct.
Cataract through the ages. This topic. If we Hokkien people say 蛇膜, right? Uncle, auntie, if you want to hear maybe I 蛇膜, this is the topic, yeah. If you want to ask any question, should you have ada apa-apa pertanyaan, ini adalah ini kali lah. Hurry up and grab your chance because she will be here for us for another 10 minutes. Yeah? Any question? 如果你们有什么问题的话, pertanyaan tentang cataract, please feel free to ask. So let's go on this topic. Now she'll be touching about cataract through the ages.
So cataract, 白内障蛇膜, is the commonest cause of blindness in the world. And you can help by treating them because it's curable.
It's curable.
And the surgeries have now become so modern and successful.
Yes.
So it's not like the olden days where it's so mafan to look after it. It's not that difficult anymore.
Yes.
Okay.
Okay, can be cured. Yes. This is the main thing.
So you can see the clear lens.
Yes.
When you don't have cataract, the light can go through. But when you have cataract, when your lens is cloudy, then the light doesn't quite go through. So you get all sorts of symptoms. Okay. So it can affect anyone at any time point. So you can develop it at birth, very rare, but one in every 10 to 15,000 births, one baby will have cataract.
Since born?
Yes. Those are congenital ones.
Okay.
And then you can have childhood ones. For whatever reason, genetically, they can develop cataracts. The younger people from myopia, as we talked about, the drugs they take or accidents.
Yes.
And then your common ones, the old age.
The common one is the old age. Okay. So for young children, how do they detect their cataract?
So you can see a lot of parents, they'll turn up to see me because they can see one white pupil.
Oh, right. Through their eyes got the like that
white pupil.
Oh, okay.
Okay, when they see their babies, the baby's
it's
pupil.
apparent one lah.
Yes, it's very apparent.
Okay.
And
it's not a tear or anything.
No.
I see.
No.
Okay.
So it could be passed down from parents, or it can just happen
just
isolated.
Like that. Okay.
Yeah. but it's treatable.
It's treatable.
It's a treatable
so
childhood.
Kanchiong can treat one.
Yes.
Okay.
Treatable childhood blindness.
Okay.
But it has to be treated fast. Okay, so the timing is very crucial.
Yes.
Okay, it needs to be removed as quickly as possible, and it's a complex surgery.
It's a complex surgery.
Yeah. So it's a long-term care for them.
Right.
But again, the important thing is it's treatable.
Yes, it is treatable, ladies and gentlemen, but long-term care.
That's right. So adult cataracts, the ones that we know,
Yes.
It's not just cannot see.
Yeah.
You can get a bit blurry.
Blurred
Sometimes
vision.
nighttime driving is difficult.
Okay.
Some
Light
of them,
sensitivity also.
yes.
Okay.
Yes. Or when you turn the lights down just a little bit, then they struggle to see.
Ah.
Yeah. So bright light they can see. When the light
Dim
is dim,
light, then
just a
cannot
little
lah.
bit, then they will feel that my
What
vision
is that?
yes.
Okay.
They can double vision,
Double vision.
right? So these are the common symptoms.
Okay.
Now, so
Okay.
you can see.
We have
So
a
some people-
comparison here.
Yeah, they'll tell you I can see, but actually you look at the quality of vision.
It's very poor.
It's poor. But when you have cataracts in both eyes, you can't tell
Yep.
because you can't tell what is good anymore.
Yeah, lor.
Yeah.
Some people don't know how to explain also.
That's
I can
right.
see lah, but
Yeah.
like that only lah.
Yeah.
Especially the elderly, sometimes they can
That's
be
right.
quite, stubborn, right?
So that's when they run into trouble. Okay. So people think that you need to see that white spot in elderly patients before you can
Yes.
see it's cataract. But most cataracts will look like that. Unless you
Oh.
go to your friendly ophthalmologist, they dilate your eyes and you can see it.
I
So
see.
it's important
Sometimes not very apparent, is it?
because you need a microscope to see it.
So
Our eyes are
naked
so
eye like that
small.
cannot.
Yes. So it's best to go to your, doctor
check.
to have it checked and get advice for it.
Mm.
Surgery is very fast. It's microsurgery. We're all talking about millimeter incisions, no sutures. Recovery is very fast. So it's not like the olden days where
How long will a normal cataract surgery take usually?
10 to 15 minutes.
Oh, that's fast, huh? 10 to 15 minutes.
No injections, just eye drops.
Is it? No injection. So the patient is
No, patients aware.
aware,
Yes.
but not painful lah.
No.
Okay.
Faster than your hair salon treatment.
Faster than I
Yeah,
style
you
my
cut-
hair this
that's
morning.
right,
Okay, that's a
Okay.
fun comparison.
And then the post-op care is actually to bust all the myths, right? You just have some eye drops to use. You can use your screen time.
Still can see screen time.
Yes.
Okay.
Yes. You can eat any food you want. There's no food restriction.
Okay, there's no diet control.
You can go back to your physical activity, your walking, hiking,
all can.
weightlifting within 2 to 3 days. Yeah, you just wear a
Within
shield.
2 to 3 days can
Yes.
already. Oh, okay.
Just no swimming.
Just no swimming.
Yes.
Okay, no swimming after post-surgery of cataract.
Any eye
guys.
surgery. Yes.
Yes. Okay.
And then you just wear a shield at night to sleep.
Okay, that kind of
Yeah.
shield.
That's it.
That's
so
it.
it's quite simple.
It's quite simple and
Quite simple
straightforward.
because the technology is so advanced now.
That's right.
Yeah. So what happens when you don't do it? So this is when you see a lot of old people falling
Fall
over
down.
because they can't see
Yeah.
and they don't realize that they can't see.
Yes.
So that's when they
Actually, a lot of old people, they don't realize.
Yeah.
Mm.
So all their parents, old parents, elderly parents should have eye checks like medical health checks.
Yes.
Just go to your optometrist or your doctors. Have a quick
And
look.
get it checked, right?
Yeah, that's right.
Okay.
Okay, so just very quickly, cataract is very common. It's not difficult to treat. It's curable.
Yep.
And by removing it, you can prevent blindness and all the other complications.
Yes, that's right. Okay, that's the end of the sharing. Now, Dr. Tsiang is at Isaac Penang La Road, right?
Yes.
Yeah, so if you have any concern about your eye or cataract or even myopia for your child, you do not know where to go, please feel free to visit Dr. Tsiang at Isaac Penang. Now, thank you so much for joining us
And
today.
thank you very much, Anna.
Thank you so much.
Thank you.